Becoming a periodontist, a board certified periodontist, where you are responsible for bridging the gap between oral health and overall health. Today, we're going to be talking to uh, a doc who just finished her perio residency on her way to become board certified, and she's going to be sharing with us why perio, what a typical day is like as a perio resident, what research is required, things that she liked most, things that she didn't like as much, and also some of the challenges. And not only is she going to share tips and advice for those of you that are considering perio, but also she's going to lay out some of the best characteristics or most important characteristics that you need to have as a periodontist. So stay tuned, but also stay all the way through to this episode. Okay. Um, just want to let you know that this episode is being brought to you by GetIntoDentalResidencyChallenge.com. This is the ultimate resource that helps you jumpstart your residency application so that you get attention immediately so that you can get into your ideal residency program of your dreams. For more detail, check out the link down below and use that resource for yourself. All right. So today we're joined with a person who's been on our episodes a couple times before, but it's been a while, right,
It's been
Doc?
some time, 3 years,
It's been some
yes.
time because you've
hmm
been spending time being busy,
I was busy, very
busy,
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 trying to get through,
booked and busy,
booked and busy.
trying to survive and get through. Today we're
Yes,
joined with Dr. Shelly Taylor, who's going to talk all things perio, but more specifically how she survived the perio residency, which is 3 years. So, Doc, for those of you that haven't maybe watched our previous episode, which is where is it at? It's right over here. Check out that previous episode over here. For those that haven't seen that episode, please introduce yourself. Tell us where you're from and where you just finished, what you're doing now, but also where you finished your perio training.
cool. Yeah, so I'm Shelly Taylor. I'm from Fort Lauderdale, Florida, the Sunshine State. And I went to dental school at the University of Florida. So go Gators. I was a double graduate of the University of Florida. So I did my undergraduate there and also my dental school. And after graduation, I worked at a federally qualified health center for some time. And that's where I found like more interest in periodontics because a lot of my patients needed periodontal care but couldn't afford it. We had a periodontist who was able to help our patients, but I saw that was a greater need, and I wanted to be able to bridge that gap between periodontics and public health because we know that in our community really needs periodontal care. So I decided to get my master's in public health from Harvard University T.H. Chan School of Public Health. And that's where I learned more about how we could treat our patients better with education, research, bridging that gap between oral health and a person's overall health. And so when I completed my my public health program at Harvard, I continued on to Columbia, where I became a periodontics resident. And I was very excited about that opportunity because that is like my ultimate goal to bridge the gap between periodontics and public health in a federally qualified center setting.
Awesome. Awesome. And bridging the gap is important. And perio, of course, is one of those residencies that
Mm-hmm.
really, or that's one of those specialties that really enables you to do that. But that's if you realize that that's what you want to do, right?
Mm-hmm.
And that means you have to make a determination between all of the different specialties. So tell us, why perio for you? Why did you choose perio instead of maybe oral medicine or oral pathology or oral surgery?
Yeah, so I enjoy saving a person's teeth. That's very important to me because it's nothing like the teeth that you have in your mouth. And so I enjoy working with patients, providing the treatment to help save their teeth. And I also enjoy just the relationship I get with my patients because with periodontics, you're with this patient for a very long time. So I enjoy building that rapport and seeing how my patients improve after periodontal treatment. Also, I'm very interested in medical and dental integration, and periodontics bridges that gap between your oral health and your overall health. Because we know by research that if we treat the periodontal disease in a person's mouth, we can see better health outcomes in their overall health, reducing the blood pressure, reducing the patient's A1C. So I like to be that advocate for the patient. Hey, let's help your oral health. Let's get you together so you can see some benefits in your overall health as well.
Yes, perio, importance, and its importance in oral health integration into medicine. Some may say or even think that even though we're separate, dentistry is separate than medicine. We are really connected as a specialty of medicine, right?
Yes.
And depending on where you train, you get that kind of reinforcement, that kind of perspective from several institutions who have a curriculum that's has shows that and has that integration as well. But that's a whole nother discussion, right? But it is an important discussion as to why perio matters, why oral health matters. I just remember recently seeing or hearing about an article related to flossing and the study that was done related to flossing and how flossing and reduced stroke incidents and those that also had some issues with diabetes as well. So
Mm-hmm.
there's a lot of research that's out there, evidence-based research that demonstrates clearly the importance and the link between overall health and oral health. And perio is one of those specialties that continues to bring those connections to the forefront as well. So let's talk about what about
Mm-hmm.
research? Tell us during your residency program for the first, second, third year, how is research incorporated into the curriculum and what's required, what's suggested, what do people typically do as far as your other classmates as well?
Yeah, so you could go on a master's track, and that's the master's track. That's where you do your research through Columbia, and they will give you time allocated towards your research. But I didn't go through the master's track, so the details for that I'm unsure. But you do have time to complete your research. If you don't want to do research, you could do a case study, and then that's basically your third year. You review one of your cases and write it up as a case study. And for me, I collaborated with the CareQuest Institute for Oral Health, and I co-wrote a research paper on like the effects of healthcare costs and with patients with diabetes after they receive periodontal treatment. So that satisfied my requirement. So even if you don't go through with the master's program to get the master's thesis, you still have to do some type of research in the program.
Now, you mentioned a collaboration that you had. Could you repeat that collaboration and talk about the research and just maybe real quick, if you can, just a quick summary or findings that you that were part of that endeavor?
Sure, yeah. So with CareQuest Institute for Oral Health, they're a nonprofit, and they mainly focus on um, providing the foundation, the tools, and the resources needed to expand oral health access for like patients who are underrepresented or don't have the funds for like dental treatment. And so one of the research topics that I was involved with was the relationship between diabetes and patients with diabetes and periodontal disease and the associated healthcare costs after they receive treatment. So what we found using claims-based data, patients who receive periodontal treatment, both Medicaid and commercial claims show that it was a reduction in healthcare costs. So that was the paper that I co-wrote with the researchers at CareQuest Institute for Oral Health.
And that's good to know because that type of research, that type of information continues to allow us to advocate for not only oral health care, but also specific things that continue to demonstrate the importance and the connections between the two, right?
Exactly.
Unfortunately, a lot of our colleagues in medicine do not get any training in
Mhm.
oral health, even though they get training treating, diagnosing, and helping individuals who have teeth, have a mouth
Exactly.
that's part of their head that's still connected to their body, right? There's no separation.
There's no separation. We're all
No
connected.
separation.
The head is
Yeah.
not over there.
So, that type of research continues to and also enforce the importance of making sure that all healthcare providers understand the connections, understand the integration, understand that some of the things that they are seeing with their individuals that they're treating can have can be connected, and because of their or lack of oral health or their condition of the oral health, which also hopefully will continue to emphasize the importance of making sure that nursing students, medical students, surgery students or residents all receive within their curriculums and their residencies or even medical and nursing school curriculum topics on oral health, right? Outside of just not just periodontal disease, but also the number one most preventable disease in children, which is
Your
dental
case.
decay,
Yes.
right?
Mhm.
So your research and those of our other colleagues throughout the profession continues to be an important link in making sure that we have improved outcomes, because those improved outcomes also mean, as you demonstrated, I'm sure we're able to identify in your research, it also means less cost,
Exactly. Yeah.
right? Less cost on the front end, right? Especially
Yes.
with insurance
Preventative.
companies, right? Preventative, right? Especially with insurance companies always, well, I'm not going to say always, and this is a whole nother discussion,
Yes.
but having a propensity to not cover certain things, but also especially certain things that can prevent the escalation of more cost or more disease and yada, 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 yada. Again, a whole nother discussion, but the gap or the link is periodontal disease, right? And being
Yes.
able to prevent it on the front end and having that awareness, which is
Exactly.
so very important, right?
Yes.
So we'll put there's a link to your research down below. Feel free to take a look at that and contact Dr. Taylor about that research, because it is something that we will continue to have to use to advocate, which we shouldn't have to do. It should be automatic, but to continue to advocate for why oral health matters, why it's
hmm
important, why prevention matters, right? And the oral physician's role within medicine,
Yep.
right?
Exactly. In
So,
the whole healthcare arena. Yeah.
yes, yes, right. Health care, right?
hmm
Or versus out of health care for those that have no health. They're unhealthy health, so to speak, right? Again, sorry, went on a tangent, but that's a whole nother discussion, but also important to recognize here. So, got some information about research. Let's pivot, because research can be challenging, but it can also be inspiring. And the fact that, you're really enthusiastic about bridging the gap and showing where those connections are. Doc, what's the best way for people to contact you if they have some additional questions or just want to talk to you more about not only surviving perio as a resident in residency, but also future thoughts and aspirations as you are now living life after surviving perio?
Yeah, so they could email me. My email is shellytaylor.dmd@gmail.com, or contact me via Instagram at the_wisdom truth. And those are two ways people could contact me.
All right, there you have it. Check out those contact informations for Dr. Shelly. Doc, thanks so much for your time. It's been a process. It's been a long process, from applying to Perio to also just finishing up that program up at Harvard, the MPH program for oral health, minority oral health focus, to now 3 years later finishing surviving Perio and fulfilling your dream via your dream position that was more above and beyond what you dreamed about, but now how you are now living that reality each and every day. So congratulations. So proud of you. So happy for you.
Thank you.
And we thank you for your time. And I'm going to thank everyone in advance by going to this next episode. Go to the next episode right now. All right? Go.